All right, Jake, thank you very much. In a health alert, this month officially marks 5 years since the COVID-19 pandemic took a hold of the entire world. I sat down with infectious disease specialist Dr. Steve Threlkeld to reflect more on the pandemic's past as we deal with other public health crises today.
The worst thing about it was that we didn't know what to do about it. Even as we learned more about the virus, we were just doing supportive care. And it turns out that we can do pretty good supportive care in 2025 and 2021 at the time, 2020, but not good enough in a lot of people. And it would just behave very strangely. Some people wouldn't get sick at all. Some people would get very sick. But the people that died of COVID frequently got really sick about 7 to 10 days after they got it. So it took us a while to really see the way it behaved in people, what to look for, and then, of course, only later how to treat it, and then, of course, how to prevent it, too, with the vaccine.
Of course, Doctor, we have the testing that we talked about so much. We have the wearing of masks. As you just mentioned, we have the deaths. How did COVID-19 change us as a society?
Well, I'm afraid to say it changed us in some ways for the worse. I think there was just a lot of polarization about things that I don't even know how it came about, but the most depressing thing to me about it, other than, of course, the actual people dying of the disease, and we had that going at up to 10 a day, even just in our hospital, and that's very difficult to watch. But we saw people divided around things like vaccines in ways that I just truly didn't even understand as we stood around watching people dying of this infection. And it got so bad, I think, nationally, that you literally could see some people that didn't like vaccines that seemed to be happy when people had side effects from vaccines, and people who didn't like vaccines happy when they got really sick from the disease. And all that was very difficult to watch and difficult to see. And there's still a little leftover stuff. So it made for some unusual reactions in people. And I don't think it brought about the best of us in that sort of thing. And I think that was the most difficult thing about what it did to us as a society. Certainly, we suffered a lot of things like lack of education and things that we had when we closed down things. And there are people that look back and now say, well, we shouldn't have done that. And I've talked to a lot of people about that. It's easy to say that now, but we had people dying all around us at that time. So I think initially being very aggressive was good. What I wish we'd have done differently nationally is really invested in getting the cheaper rapid antigen tests, because those things could tell you whether you could give it to somebody else. Had we done that better, and there were a lot of people calling for that at the time, we could have told who could go to school safely that day. And it would have really, I think, opened up some things. So I think if I had to think of something that we should have done differently, we should have done some trials to know whether and where masks worked, to do different kind of testing so that we could open things up sooner than what we did.
And Doctor, I think a lot of people might want to know, how did the pandemic change you? Because for many of us here in Memphis and the Mid-South, you are our doctor disseminating information about the pandemic, about the disease, about vaccines. From a personal standpoint, what was kind of going on with you as that person who had this added responsibility?
Yeah, I think a lot of people that were kind of on the ground taking care of people, for us, it was about 15 months of about 7 a.m. until midnight or 1 a.m. every day, no days off. And you just endured it. And it wasn't good for anybody in healthcare. It wasn't good for families. So it was very tiresome. But I think you sort of just had to wake up every day. And I think the way I personally survived it was that when I get up tomorrow, I put today behind me. And that's neither a virtue or otherwise, but it made it a little bit easier because you just have to keep going at a time like that. But I think the nurses had it the worst. They were the ones that were in the rooms with people dying whose spouses and families couldn't be around them. Tremendous emotional toll. And I very frequently say that my worst memories of it were nurses with their own cell phones, video conferencing with families, trying to say goodbye to their relatives. And you don't endure that sort of thing, particularly the nurses, without being changed by it.
And Doctor, one last thing. How does COVID-19 continue to affect us today, especially when we deal with issues like measles or bird flu and things of that nature?
Well, that's a very good question. I hope it's made us more prepared, but I think there's a lot of water to go into the bridge to make sure that we're really more prepared. I think it's in some ways made the country more difficult to unify in those kind of directions, but we better work on that because, of course, avian flu can be the sort of thing that could be much more severe if things didn't line up or lined up badly in terms of that virus. It could make COVID look not so bad in the rearview mirror. We hope not, but it has that potential. And then measles and the like, you know, our grandparents would be horrified to know that people are dying of a disease that they regularly lost siblings from, and we wiped out of the United States. So it's very sad to see that sort of thing popping its head, and you just hope that we can come together and not be going down some sort of historical road here, because I think that would be sort of a tragic kind of event.
That it would be. Doctor, we appreciate your time and all that you.
Dr. Steve Threlkeld with Baptist Hospitals. And for more information on the impact of COVID-19, you can visit WREG.com and click on this story. We'll be right back. Stay with us.